Hi friends, now let's discuss genetics regarding inheritance patterns of different diseases in a simplified way. All enzyme deficiency disorders in biochemistry are inherited by a autosomal recessive pattern. Diseases like tyrosinemia, albinism and phenylketonuria, all these are inherited by autosomal recessive pattern except three disorders which include Fabry's, Hunter's syndrome, and the other is hyperammonemia type 2. These three are inherited via X-linked recessive pattern. Next, coming to hemolytic anemias. Hemolytic anemias such as sickle cell anemia, thalassemia and so on. All these are inherited via autosomal recessive pattern except three hemolytic anemias which include G6PD deficiency, that is glucose 6-phosphate dehydrogenase deficiency, hereditary spherocytosis and paroxysmal nocturnal hemoglobinuria. G6PD is inherited by X-linked recessive pattern, hereditary spherocytosis via autosomal dominant pattern, and paroxysmal nocturnal hemoglobinuria is the only hemolytic anemia which is acquired but not inherited one. Next, coming to neurocutaneous syndromes. Neurocutaneous syndromes such as tuberous sclerosis, neurofibromatosis, etc. All these are inherited by autosomal dominant pattern except Sturge-Weber syndrome, which is not an inherited one but it is an acquired neurocutaneous syndrome. Next, porphyrias. Porphyrias such as acute intermittent porphyria, variegate porphyria, hereditary coproporphyria, etc. All these porphyrias are inherited via autosomal dominant pattern except congenital erythropoietic porphyria, which is inherited by autosomal recessive pattern, and in lead poisoning is a cause of acquired porphyria. Next, coming to hemophilias. Hemophilia A and B are inherited via X-linked recessive pattern, whereas coming to hemophilia C is inherited via autosomal recessive pattern. Next, coming to connective tissue disorders. Connective tissue disorders such as Ehlers-Danlos, Marfan syndrome, osteogenesis imperfecta, etc. All these connective tissue disorders are inherited via autosomal dominant pattern. Now, coming to mitochondrial disorders. The two classical examples of mitochondrial disorders are, one is Leber's hereditary optic neuropathy and the other is MELAS. MELAS stands for mitochondrial myopathy, encephalopathy, lactic acidosis and stroke. Next, coming to codominance. Blood groups and HLA are inherited via codominance. Next, coming to X-linked dominant diseases. Three important X-linked dominant diseases include, one is incontinentia pigmenti, next is Rett syndrome, and the other is X-linked hypophosphatemic rickets. Thank you friends.